Hello everyone, my name is Abidemi Apata and I'll be discussing healthcare policy in Nigeria. Nigeria's population is the largest in Africa. The Nigerian population is 195 million, of which 45% live in urban and semi-urban areas, while 55% live in the rural areas. Healthcare system in Nigeria comprises of the three tiers of government, which are the federal government, state government, local government, and their function is to provide health services, health programs, and health promotions. Nigeria's health system also consists of the private and public healthcare sectors. The private sector has both Western and traditional healthcare, while the public is owned by the government. There are 5 health policies: the Western and traditional healthcare integration, basic health social scheme, primary health center, national health insurance scheme, and National Action Committee on AIDS. The main health insurance is the National Health Insurance Scheme, which the federal, state, and local government provide for their workers. Most Americans and European companies provide their staffs with healthcare services, while other companies do not. More than 50% of Nigerian population still uses traditional medicine because it is cheap and easily accessible. Most problems of healthcare in Nigeria includes people's attachment to customs, ignorance, poverty, and so on. The coverage of healthcare in Nigeria is a mixed coverage system, which includes public and private sector. The health institutions by the government in Nigeria includes 33,000 general hospitals, 20,000 primary health centers, and 59 teaching hospitals. In Nigeria, health access is only 43.3%, and about 70% of the healthcare is provided by the private vendors and only 30% by the government. The Nigerian government established the NHIS to eradicate the country's financial problem, simply to reduce the high cost of healthcare for children under 5 and for armed forces, police, and uniformed services. Federal Ministry of Health establishes primary health center to increase coverage, to change the orientation of health, to improve efficiency of services, and to involve communities in decision making. The components of primary health care includes immunization, environmental sanitation, and treatment of ailments, and so on. The mandate of the quality of the healthcare is to provide quality services, to give patients the right to choose their providers, and for patients' privacy. WHO ranked Nigeria 187th position of 191 member countries. Because of the poor quality of healthcare in Nigeria due to their indiscipline, inadequate healthcare professionals, and poor or no medical equipments. The cost of healthcare is very expensive in Nigeria, and many people cannot afford it. Over half of the population live below the poverty line of less than $1 a day, and so cannot afford the high cost of healthcare. The choice of care, health provider, and hospitals are a huge factor in Nigeria, which means no matter your status, you still have to pay out of pocket for health care. Many Nigerians would choose traditional treatment over Western and modern healthcare services because it is cheap and because of their tradition and custom and beliefs. Because of the choice of traditional medicine, the government integrated the traditional medicine into health services due to the active pharmaceutical usage, the expert knowledge of traditional healers, and because both the traditional and modern healthcare services have many things in common. And in comparison of the modern health workers to the traditional healers, we have for the modern health workers, pharmacists, nurses, and as well as for the traditional healers, we have bone fracture healers, herbalists, and so on. Here are my references. Thank you.